So thank you for having me here, and thank you for the opportunity to speak today. So to Chris, Chloe, Claire for organising and inviting me here, and including Jennifer, who originally invited me here. I know a lot goes into organising these days, having done similar events elsewhere, so I don't take the opportunity to speak to you today for granted. So I want to begin, because I'm here, by acknowledging the traditional owners of the lands that I'm coming in from today, the Turrbal and Turrbal Yuggera peoples, and want to pay my respects to elders past and present, and any Aboriginal and Torres Strait Islander members here today. I make that acknowledgement recognising that First Peoples are more aware than most about the relationship between political voice, unearthing truth, and renegotiating a better future, and that's crucial to justice. I hope those opportunities still exist here in this state beyond 2024. I also want to note that in the talk today, I briefly discuss human rights issues, not in any great depth, but I'm acknowledging that in case anyone who has had those experiences of harm need to do anything to support themselves. So luck, opportunity, and action. Those are the three ingredients I think are crucial to enduring systemic change. But the people in Wollston Park, they weren't afforded that luck. Places of degradation, torture and abuse, this was made possible by the state. Luck didn't just evade people in Wollston Park. A lack of luck continues into the current system today. As we speak, hundreds if not thousands of people are secluded and detained within mental health wards in Queensland. Their voices are being denied, their truth is not being legitimised, and their future is being written for them, not by them. I say that knowing my own mixed bag of luck. I had bad luck early and later in life that gave rise to my own mental health crisis and breakdown. And I remember being not far from here when I lived in Brisbane on the 120 in the midst of my own crisis. But I had the luck when I had that breakdown to fall into the hands of families, my friends and good supports. I didn't fall into the hands of the compulsory mental health system. And so I've got that individual luck. But luck doesn't just operate at the individual level. It operates at scale. As a sector, you've had some luck. As a result of luck, opportunity and action, you're one of very few states in Australia that has a Human Rights Act. That's luck that people and mental health advocates and consumers in the NT, in New South Wales, in South Australia, in Tasmania and Western Australia don't have. It's something that we should cherish and not take for granted. Questions that Human Rights Act gives rise to an opportunity to ask big questions. Questions about, well, what's the system for? What is the system meant to do? At present, our mental health system is still kind of governed on an industrialised medical model, where the kind of allegedly obvious purpose of the system is to treat mental illness. That approach, wherever we look, isn't living up to expectation. It asks us to beg big questions. Fortunately, you've picked up on that sooner than others. The Alliance's Wellbeing First framework asks those questions, and it articulates something different. It provides a vision of a system grounded in well-being, community support, social and economic participation, and might I add, lived experience. It creates the conditions for lived experience-led care as well. Now, if we take that seriously, that system looks less like an industrialised medical model of treating sick individuals, and more of a kind of organic ecosystem that supports people to live in conditions of well-being, to support us on our own, and then to support us on our own terms when we're in distress and even when we're in crisis. Treatment may be a component of that system and that approach, but it need not be the governing purpose of that system. At least that's what I read from the work, and I've heard that here today as well. So you've actually already done a lot of that work, so you might be asking, well, what's the point of you being here, Simon? You're not really much of a value add. I hope I will bring some value. And that's because, as you know, it's not necessarily happening. That transition may have started, but it's not complete. The same things are being funded. Billions is being funded into the same systems, expecting something different. You've got the destination of where you want to get to. I guess my argument is that a Human Rights Act helps you to get there. Queensland Human Rights Act provides you with a legal, moral and accountability framework to bring that vision, the Wellbeing First vision, to life. It helps you set out a plan to monitor actions and to drive accountability. It does so by imposing a duty on the Queensland Government and on public mental health services, and that includes community mental health services, to act and make decisions that comply with human rights, and when you're doing so, give proper consideration to human rights. That kind of means it's got two measures in it, that law. The first is that it requires human rights to be upheld. So any limitations on rights need to be justified according to kind of really strict circumstances. And the second is that whenever you're making decisions, and we'll unpack that later, but whenever you're making decisions that might affect human rights, you need to be able to prove that you gave proper consideration to human rights, and not just to human rights in general, but to specific human rights. And that kind of proper consideration test, it requires proof, and really it's a kind of sniff test on whether people are serious about human rights or not. So it's a necessarily kind of high bar, and it applies across a kind of vast cross-section of the system. Those duties don't just apply at kind of the point between the consumer and clinician, and that's how we often imagine human rights as applying. It obviously applies there, it should apply there, it should be enforced more at that point. But it applies when a minister, a comrade commissioner, a CEO, anyone working in the mental health system makes a decision that could later impact on human rights. It's early intervention for human rights. That's what it is, and it creates an enforceable duty to do that. And if, by the way, if you're using your phones, there's a QR code here, and it'll take you to a free resource on how the Human Rights Act can enhance Queensland's mental health system. I'll put the QR code on the last slide as well. But this is really important because it applies to so many of the decisions that everyone makes every day. Decisions about systems leadership and management, the commissioning of services, enforcement of care, enforcement of human rights, models of care, the kind of day-to-day clinical governance, or we might say lived experience-led governance within services, the training, not just the training we give, but the training we choose not to give, or whether the training we're currently giving is actually unintentionally creating the conditions for human rights breaches. It applies everywhere. In what follows, I'm going to try to give some practical examples of where human rights really do make a difference, and hopefully make a difference in a way that assists the kind of wellbeing first vision that you're moving towards. So how do we know good from bad in the mental health system? You know, what should be the indicators of success and what should be the indicators of failure? You know, I've worked really deeply in establishing an outcomes and accountability framework in Victoria, and I know these kind of frameworks are crucial to driving systemic change. Current systems, for all of their rhetoric, still run on that kind of industrialised medical model of mental health care. That model is still focused on kind of, and I'm really talking in many respects about that system that gets a lot more funded than yours, the sort of pointy acute end of the system. It's focused on containment and control. And then the funding parameters are very often focused on outputs. You know, so the number of people treated, number of days in a bed, the readmission rates. It kind of it reinforces the incentives for the system to kind of operate like a conveyor belt in which someone's put on the system and an input of treatment is provided and the person comes out the other side. And that's going to happen either way, either voluntarily or by force. That's not a system that's being set up that is indicative of a human rights-based approach. That if we move to your wellbeing first approach and we move to a rights-based system, it's one that's built to support people to live a good life as defined and chose by them. With that underlying purpose, the kind of domains, indicators, measures, whatever you want to sort of bang on about, they are all about increasing choice and addressing the issues that decrease choice. It's about creating indicators about more cultural safety and addressing the things that decrease cultural safety, the things that create more trans-inclusive mental health care and the things that undermine it. And you're creating a system of incentives and measures to reflect that. So the purpose of the system changes when we ground it in human rights. And it's important to say here, that's not just a good thing. It's not just the case because you've argued for it in the Wellbeing First framework. It's because that's actually the proper application of the law to the mental health system. It is required. So how does it change when we're talking about funding? You know, your Human Rights Act gives you the opportunities to ask questions about how things are funded. Bricks, beds and meds. That's the way we still kind of do it in 2024, and I saw that in the lead up to the election. That was still kind of the pervasive message, and I hear the strength of the advocacy that the Alliance has done here, but the weight of the inertia of the present is hard to move, isn't it? We do that, and billions of kind of taxpayer money is going to the same things, including the mental health levy that I think you have here in Queensland as well. Despite knowing that it produces human rights breaches, that approach produces more human rights breaches, and then we don't have evidence of positive outcomes on the other side of it as well. Again, if you had a mental health system that was grounded in human rights, it would be one that rebalances the system to focus on well-being, to focus on the social and political determinants of mental health, on community resilience, and then it would change the types of services that are funded. You're still achieving the same outcome, which is to prevent and deal with distress, including crisis, but you're doing it in a way that provides fewer restrictions on people's human rights. That's incredibly important when we think about the amount of money that's going into bed-based services as opposed to hospital in their home programs, as opposed to, I can see people from Brook Red here as well, in lived experience-led services and community-based services. Those services are more culturally safe, they're more grounded in supported decision-making, they're more responsive to people's individual needs. They are a way to achieve the same outcomes, but with fewer restrictions on human rights. So if the government based it on that, it based the system and the way it funds services on human rights, you would see that shift. And again, it is not just a good thing to do. It is what the law requires of the Queensland Government. Your Human Rights Act also gives you the opportunity to rethink the governance of your organisations. So, I mean, I actually find governance really interesting, but I'm sure probably half the audience just vomited in their mouth. But it is really important. Treatment via risk containment and control. That's kind of the common kind of implied nodes in the governance of mental health systems. And, that's a response to a lot of historic and institutional features that have preceded us here today. The governance, in particular at the acute end of the system, is kind of built on these implicit messages that people are to be feared and they are to be treated. It manifests as building new seclusion rooms when we could build more greenery, making more fish bowls when we could create more inclusive environments for people to be in distress and be in crisis. It manifests as clinical reviews that focus on the same risk-based approaches that lead to more restrictive-based practices. It leads to more ignoring of complaints when there's opportunities for change, and it ultimately leads to lower morale within mental health services because people aren't doing the work that connects to why they were doing it in the first place. So again, a mental health system that's grounded in human rights would be one that changes how we govern mental health services, or indeed why. Again, it's about trying to support people to live a good life as chosen by them, and that's something that you've already articulated in the Wellbeing First strategy. All new initiatives, like new buildings, would require and they should require already a new human rights impact assessment to show that it's disability accessible, that it's trans inclusive, that it prioritises supported decision making and cultural safety. Does the way we're building this environment give people more or less choice? Does it make them more or less culturally safe? Have we turned our mind to that? Not just a good thing, it's required. it doesn't just mean sort of faffing about how we, value human rights in documents. It actually means, for example, when you're designing a model of care or you're designing a new service, you actually forecast, well, what parts of the current system present a real risk to human rights? What parts of services currently present a risk to cultural safety for Aboriginal and Torres Strait Islander people? What parts of services present a risk to someone's right to make their own decisions, to support a decision making? It's about forecasting, identifying those risks, and then actually putting things in place to mitigate and address those risks. That's what human rights and a human rights-based approach to governance, design and operation requires of us, and it helps us create better services and better systems. So it's a measuring tool, and it helps us keep governance on track. It's also an opportunity to rethink expertise and how we deploy it, who works and how they work. So medication management, mental state examinations, risk assessments, it's kind of the common competencies that are required within the current sort of mental health system, particularly at the pointy end of the system around mental health nurses, psychiatrists and other workforces. And in many respects, these practices, we know, for example, suicide risk assessments, there's not an evidence that they can accurately predict risk, and yet we know that they lead to more coercion as well. These practices present a risk to human rights, and yet we're training our workforce. We're training a whole generation of new workforce in these things. A human rights-based approach would change that. It would change the composition of the workforce and how we work. It would be, foregrounding the need to provide culturally safe care. Organisations would therefore be mandating cultural safety training as a way to meet those legal obligations. They would be designating traditional healers within mental health services to meet the cultural needs of certain community groups. Social and emotional wellbeing workers would be designated at the point of designing a service in the EFT within that service model, because if you don't do that at the point of service delivery, that's going to undermine people's cultural rights and rights to equality. There's a whole range other there, but I reckon I could faff on for too long, so I'll keep moving. But again, the way we would structure services change. The things that we would be doing inside of services would change. So all this presents today really is just an opportunity. When human rights are at their weakest, the Victorian Supreme Court reflected that governments kind of treat it as mantra. That is that human rights are kind of referenced after the fact to justify a decision that's already been made. And I certainly know, doing advocacy in Victoria, my eyeballs start to bleed when I hear, human rights is at the heart of everything we do. And I say, great, it's a shame it's not in the paper though. Or there's no evidence. It never passes the sniff test. And that's what a Human Rights Act actually allows you to do, is to create an accountability mechanism to hold government to account, to say, not just is it at the heart, but is it part of the decision making? So we all deserve and need respect and dignity, especially when things are tough. I might add. So I spoke to the CEO actually of Malik, the consumer pick that you've spoken about earlier, and I spoke to Jörn, who's been doing a lot of advocacy in this space, and he provided this quote. He said, "We all need and deserve respect and dignity, especially when things are tough. We must go beyond citing the Human Rights Act in kind of feel-good statements and at the start of our documents. We've actually, if we want mental health systems that afford a dignity and recovery, then human rights must be the touchstone for all of our thoughts and all of our decisions, and not an afterthought at best. Without a rights-based focus, the distinction between care and abuse becomes easily blurred. This is the opportunity to draw those distinctions and then to make them matter in the eyes of the law." So for that opportunity to be taken, for us to move from the kind of system we've inherited to the system that all Queenslanders deserve, we have to take action. But the social and political reality of laws, including human rights laws, is that they often require the community and system support to ensure they're complied with. It's kind of the connections between us and the collaboration between us to hold everyone accountable collectively that make human rights most binding and most transformative. So with that in mind, I'll finish with kind of 4 actions that you might consider to drive systemic change. The first is to start at home. Undertake your own review of your organisations and whether your board, policies, procedures, practices and culture align with the expectations of the Human Rights Act. These laws are still relatively new in Queensland, so you will likely have significant work to do, and that's okay. But it's your opportunity to start building the system of tomorrow today, and you're starting at home first. So undertake your own review and commit to action. The second is to work with lived experience peaks, and in particular the consumer peaks, to drive systemic change. Find out where the consumer peaks, where consumers accessing your and other services are seeing the biggest human rights issues, and use the Human Rights Act as a vehicle to try to drive change in collaboration with those peaks. The third is to advocate to clinical mental health providers to better comply with their human rights obligations. So an independent patient rights advisor exists here in Queensland, and that's a crucial role, but community mental health workers also have an incredibly important role in walking alongside people, including when they go into the clinical mental health system. They can advocate for someone's individual circumstances, but they can also draw on the Human Rights Act to advocate for changes in the kind of governance, design and operation of those services that people are interacting with. The fourth is to advocate to government. Governments have some of the biggest levers to transform human rights in your state. The hospital agreements, to my viewing, still don't have, I looked at these recently, they still don't have human rights obligations tied into them for the scale of money provided. Really recent important strategies by the Queensland Mental Health Commission have identified human rights throughout. But, recent inquiries I saw, like the Prince Charles Hospital, had contemptuously little human rights referenced or applied throughout it. So there's a lot of work to do. And so there's an important role for community mental health orgs to speak privately and publicly in favour of real concrete actions on human rights in the areas that are crucial. And that dovetails with the rebalancing of a mental health system in favour of more community, grassroots, social and economic determinants and lived experience-led forms of care. So again, why do it? Well, because it's good, because people with lived experience are asking for it, and because it's what the law requires. So if we do this, we're going to have a mental health system that meets our needs, provides the types of services that support us where we are, realise the kind of workplaces that are fun, rewarding and safe to come into, and get better mental health outcomes for Queenslanders, those with lived experience and those in general. So it's luck and opportunity that you've got. It's now time for action, and I'll leave that with you here. Thank you.